So the integument in the integumentary system, it's the largest system of the body in terms of true anatomical size. It's going to include all of the skin and any of the accessory organs within the skin. It's also going to include the connective tissue that's going to hold the upper layers of the skin down to the lower layers of the skin, or the superficial area of the skin to the deep area of the skin. It's also going to be any of the areolar connective tissue and seral epithelial tissue that we see surrounding any of the organs that keep the organs in place within the body. So when we talk about things like the omentums and the mesentum, those are going to be part of the actual integument. It's also going to include any of the mucous membranes of the body. And so what the integument is going to do in terms of the overall function of the body is kind of a uh, very long list. And so we're going to take a look at some of the more important functions here, as opposed to the continual line of functions that we have. And so it's going to be protecting the body. It's going to protect the internal tissues and organs of the body in terms of their ability to stay in place while we're moving around. And so we want to be able to move around, but not have the organs move out of place. Is going to protect the body itself in terms of its involvement with the immune system by creating a barrier from the outside environment. This barrier from the outside environment is very important because it's going to protect the body from excessive dehydration. The more superficial layers of the epidermis actually create a coating effect around the body of a hydrophobic barrier that limits the amount of water passage that will take place. It's going to protect the body against abrupt changes to temperature, and it's going to be heavily involved with thermal regulation. Now, we have an evolutionary advantage that we've developed due to our bipedal mode of locomotion, where we are actually able to do long duration and long distance activity because of the arrangement of the capillaries and arterioles within the dermis that allow us to very effectively thermal regulate, and we'll get more into in depth with that when we look at the dermis itself. It's also going to help with disposal of metabolic wastes. The sweat that we are producing is part of the excretory functions of the body. So not only is sweat going to be involved with thermal regulation, but it's also going to be involved with removal of metabolic wastes. We have specialized receptors within the dermis and at the edge of the dermis and epidermis that allow us to have distinct senses to the external environment due to changes of pressure across the skin itself. We also have receptors there that are going to be able to differentiate temperature. It's going to be involved with storage sites for water and for fat. One of the things that happens as we age is we become dehydrated, and that dehydration leads to a lot of the anatomical changes that we'll see within the integument within the skin. It's going to involve with storage and depositing of adipose tissue or fat in the hypodermis and in the subcutaneous tissue, what's usually referred to as ornamental fat. And it's going to be heavily involved with the synthesis of active form of vit D, vitamin D, which is a key ROS controller within the body. It is linked with normal bone metabolism and with normal calcium regulation as well. So let's take a look at the system in terms of an overview of what we're looking at, and we're going to spend most of the time here looking at the skin itself. And so when we look at the skin itself, we basically have three distinct layers of the skin. The most superficial layer is the epidermis. The epidermis is bounded by the basal membrane, or the basement membrane here on the image. So stratum basale, which we'll talk about in a little bit here, to stratum corneum. That is the layer of the epidermis. We then get to the dermis. The dermis begins at the dermal papillae, or the dermal ridges. And notice that we have this kind of nice hard break in between the epidermis and the dermis. We don't have that same break with the lowermost or the most deep tissue, that would be the subcutaneous or the hypodermal tissue. In the dermis itself, we're going to see things like capillaries and arterioles. We're going to see sebaceous glands and the erector pili muscles. We're going to see things like sweat glands uh, and sweat ducts, or sudoriferous glands and sudoriferous ducts. We're going to see things like all of the nerve ending processes and sense receptors. As we get within the most deep tissue within the dermis itself, we get to the subcutaneous tissue, or the hypodermis. This is predominantly adipose tissue, and this adipose tissue acts as a thermoregulatory brake as well as a cushioning agent to the body in between the most superficial areas of the skin and the deeper areas of the underlying musculature. Within this subcutaneous tissue, we'll start seeing a lot more of the loose areolar connective tissue, whereas within the dermis, we're going to see a lot more of the irregular, dense connective tissue. Within the skin itself, we will also have a host of accessory organs. These accessory organs are responsible for protection, thermoregulation, and sensing of the external environment. And so these accessory organs are going to include things like the hair and erector pili muscle and the associated sebaceous gland, nails, the sudoriferous glands, what most people refer to as sweat glands, and there are distinct types of sudoriferous glands. And then all of the sense organs that give us a sense of what the external environment happens to be around our body. And so we'll get a lot more detail into each one of these as we go through the lecture.